Hey everyone, it's Healthy Living again, and today we're going to talk about blood pressure and hypertension. So what is blood pressure? When your heart beats, it pumps blood to your body through blood vessels. Your blood pressure is the force of the circulating blood on the walls of your blood vessels. Blood pressure is stated with two values. The first number is your systolic blood pressure, which is the pressure on your artery walls when your heart beats. The second or bottom number is your diastolic pressure, which is when your heart is at rest between beats. So you would read this blood pressure as 120/80. Hypertension is consistently elevated blood pressure. According to the American Heart Association, there are two stages. Stage 1 is when your systolic is between 130 and 139 over diastolic between 80 and 89. Stage 2 is when your systolic is 140 or over and your diastolic is 90 or greater. So who has hypertension? About 75 million Americans across the country have been diagnosed, and about 1/3 of all the adults in the US are classified as having hypertension. It is very rare to see in young kids, and it starts to become common at the age of 19. The most common age of onset is 41 and older. For individuals under 45, hypertension affects more men than women, and for individuals older than 65, it affects more women than men. African Americans develop hypertension more often and at an earlier age than whites and Hispanics. Primary hypertension, the most prevalent of all, is also known as idiopathic hypertension because it has no known cause. Secondary hypertension has an identifiable cause, and these can include renal artery stenosis, oral contraceptive use, or adrenal tumors. Labile or borderline hypertension is when you have intermittent elevation between normal readings. Isolated systolic is when you only see an increase in systolic and your diastolic's normal. If you have masked hypertension, then you have normal blood pressure readings in the clinic but periodically hypertensive when you're home. In white coat syndrome, you may get nervous or anxious when you go to the doctor, which may produce a higher blood pressure than your normal values. Whereas if your blood pressure is taken in a different area or at home, or you don't see that doctor's white coat, your blood pressure will be at a normal level. Non-modifiable risk factors of developing hypertension, which we can't change, are African American ethnicity or family history, and some modifiable risk factors include stress, obesity, smoking, and chronic alcohol abuse. To test for hypertension, you'll first take blood pressure. If it's 140/90, you'll take the blood pressure again. If that level was significantly lower, you'll take the blood pressure for a third time. If the clinic blood pressure is 140/90 or greater, you'll have other tests such as APBM or HBPM. The ambulatory blood pressure monitoring is a portable machine that inflates a cuff around the arm to take blood pressure. The patient keeps on the cuff for at least 24 hours, and the machine takes readings at regular intervals, and you take the average value of at least 14 measurements to confirm diagnosis of hypertension. Home blood pressure monitoring is a device with a cuff that a patient takes blood pressure with. You take blood pressure twice a day, in the morning and at night, and each time you take blood pressure twice, 1 minute apart. You take it from 4 to 7 days, and the average value of BP over those days is to confirm hypertension. Hypertension in its early stages is usually asymptomatic, but you may experience symptoms such as an occipital headache, flushed face, or vision changes, and it can go undetected for years, causing problems such as aneurysms, chronic kidney disease, eye damage, a heart attack, and stroke.
Created using Powtoon.